Thank you all. I know people are still trickling in, but I'm going to just slowly start us off with introductions so we can kick off our event today. Thanks to all the attendees who have joined today's session, Framework for Responsible Machine Learning, Applications for Population Health and Health Systems. I'm Professor Laura Rosella, and I will be moderating today's event. Although we are all joining from multiple places, we wish to acknowledge this land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. I'm very excited to introduce today's session and our speakers. The Dalla School of Public Health's Interdisciplinary Research Cluster brings together faculty and students on one of our school's priority areas, which is using data sciences, artificial intelligence, and emerging technologies in informatics and analytics to improve population health and health systems. As part of our cluster's activities, we host conversations which will inform our work in public health and health systems. And today we're going to learn about a framework for responsible machine learning and work through how this can be applied for population health and health systems. So just some housekeeping before we get started. The chat is disabled, but you are welcome to submit questions through the Q&A function. And we will go to these questions following our initial presentation as well as during our panel discussion. This session is being recorded and will be available on Lana School's YouTube channel a few days following the event. Also, I want to let everyone know that closed captioning is turned on, so viewers can enable captions if they are needed. So the format. The first half hour will be a presentation by Statistics Canada, followed by a panel discussion, and I will introduce our panelists following the initial presentation. So our panelists for our first presenters from Statistics Canada, first I will introduce Deirdre Hennessy, who is a senior research analyst in the Health and Analysis Division of Statistics Canada. She has a PhD in epidemiology and postdoctoral training in population health modeling, which she did at Statistics Canada and the Ottawa Hospital Research Institute. The primary focus of her research has been the development of microsimulation models of chronic disease, and more recently, she's been involved in infectious disease modeling of COVID-19 to inform various public health decisions. She's also very interested in open science, reproducibility, and the use of a data science approach to better document complex models and communicate results of modeling studies, which we will hear about today. We are also very grateful to welcome Mohammed Hadu, who is the unit head of Methods, Quality, and Research section within the Data Sciences Division at Statistics Canada. We'll hear about the Data Sciences Division, actually, which I think will be of interest to many people. He holds a PhD in statistics, and he manages a group of data scientists and numerous data science projects in various areas such as survey sampling, statistical learning, machine learning, data analytics, natural language processing, and responsible AI. So thanks to you both for joining us. We're very excited to hear about this framework and talk more about it with you. I'll now pass it over to you to share your screen and kick us off.
Thanks, Laura. Thanks to you and your team for having us here today. I'm just going to share my screen and let me know if you can see that.
Looks great.
Okay. You know, we're excited to be part of the conversation around frameworks for responsible machine learning. Myself and my colleague, Mohammed, we join you from Ottawa, which is on the traditional unceded territory of the Algonquin Anishinaabe people, and we're very grateful to be here in this territory. Just gonna coordinate myself here. So we're going to start with the very simple outline to give you an idea of what we're going to talk about today. I'll provide the context and briefly describe how we came up with Statistics Canada. I mean by we, the royal we, came up with the framework for responsible machine learning. And Mohammed will outline how the framework is implemented at Statistics Canada and provide some information about future work and initiatives going on here. At the beginning of the development of this framework, which started in 2019, which was before COVID, so a very, very long time ago, we were seeing a large increase of the use of machine learning methods at StatCan. And while we had used machine learning models, previously, the availability of open source software where ML tools were prepackaged and easier to use had led to an increase in their use. As well, a lot of different types of data were flowing into our organization, from large scanner data sets from grocery stores to satellite images. And using ML techniques allowed analysts at StatCan to automate tasks like classification or develop new products and analyze large and unstructured data in new ways. And these were very exciting developments, even for myself as an analyst. We had a lunchtime learning club about machine learning techniques. But, we are the National Statistical Organization, and as such, Canadians expect us to be trustworthy, to produce quality statistics while respecting confidentiality, and so on. So any statistics that we produce using ML methods also need to adhere to these principles. And so that's, one of the main reasons that we created our framework. So, in the broader context, why do we need responsible machine learning? I think I might be preaching to the choir here, but I'm sure a lot of you know that these are very complex methods. They come with many questions. For instance, what is the impact of the decision made by AI or ML systems on individuals? Are the data that we use to build these systems appropriate for the questions we want to ask? And how do we assess the quality of the results from these systems? These and many more questions need to be answered before we can rely on these AI and ML systems, in an everyday context. In addition, some of these ML models have sensitive applications. For example, some are used to diagnose disease, others are used to make administrative decisions, such as granting a visa or work permit. And both of these applications have large impacts on individuals. And so the algorithms underlying them need to be responsibly built and also transparently built. So transparent modeling, or at least transparent reporting of modeling results, has been around for a long time in health research. And so initiatives such as the Equator Network publish reporting guidelines and checklists in order to help authors improve the quality of their publications. This supports research reproducibility and enhances the usefulness of the research. I'm highlighting the tripod guidelines here, which deal with prediction models. And this was actually one of the source documents we started with when developing the StatCan guidelines. We also looked to health economics, where there's some guidelines for decision analytic models, because reproducibility is extremely important for us when we're working in an environment, which we call a production environment, where whatever tool we use, whether it's a piece of SAS code or an ML or an AI tool, needs to work in the same way every single time. And reproducibility is really, really important for us. So just to bring the conversation back a bit to what's happening in the Government of Canada, the Government of Canada was looking to utilize AI and ML to assist in making administrative decisions and improve service delivery. And so the Treasury Board Secretariat, which essentially manages many of the activities of the Government of Canada, was asked or tasked to create a directive on automated decision making. They did a lot of consultation. They consulted us at StatCan, but this directive was put into place in 2019. And they also produced an algorithmic impact assessment tool and rating scale, which is used by departments when putting these types of systems in place. And this tool has just been recently updated. This was also a very useful tool for us in thinking about our framework, and it is actually included in part of the process that Mohammed will describe a bit later on. So back to StatCan, why did we specifically want an ML, a responsible ML framework? So I think I've convinced you that the responsible ML framework, or having one, is intimately connected with producing quality statistics. And that's really a core mission of ours at Statistics Canada. And so we have a quality assurance framework also pre-existing our ML framework. And, we love a good framework, to be honest. And in that, the chief statistician talks about our core mission, which is really to provide credible and relevant statistical information to the public in a transparent and responsible manner. And you can imagine, to manage quality and best practices, throughout like a large organization like Statistics Canada, we need to put a governance structure in place. And so our governance structure, while not exactly in place at the moment, is evolving to incorporate a data science strategy. And the ML framework will be sort of folded into the operationalization part of the strategy. And we hope that such a strategy would, enable us to produce results faster, but with an eye to quality, ethics, sound methods, and accountability. And our framework would fold into this. So all of this work is also happening in the context of open science in the Government of Canada. And Statistics Canada has also committed to using open science practices and has developed an open science action plan. So these are the 4 pillars that support open science as part of our open science action plan. And as you can see, they're extremely complementary to the framework for responsible machine learning. So now let's get right into the framework itself. It also has 4 parts. So the 4 is a very significant number too. So this slide shows an overview of the framework. The parts are respect for people, respect for data, sound methods, sound application. And ethics is mentioned within the framework, but doesn't have its own specific dimension. However, it's sort of the spoke of the wheel here that connects all these 4 parts together. And, these different themes or dimensions work together to ensure ethical design and use of both the algorithms and the results. I'm just hearing a little bit of feedback. Is my sound okay?
Yeah, it sounds great to me.
Okay, great. So let's deal with respect for people first, and I'm going to highlight a couple of these themes here. So something we really have to consider as public servants is the concept of value to Canadians. At Statistics Canada, we'd like our practitioners to have this in mind as they consider the choice of methods for a particular project. Is ML the method du jour? Is it kind of a trendy method? Or in fact, can it provide something that has not been done before? Can it incorporate complexity or create new information for the users and the statistical system? So in our framework, we encourage ML practitioners and their managers to ensure that the ML algorithm has a clear benefit for the data users. The other thing I'd like to highlight here is accountability. And this is a very important concept that's been talked about in the AI and ML literature, because the algorithms themselves are not accountable, but humans could be and should be called on to account for their classifications and predictions, particularly where they affect the interests of others. And that's part of the algorithmic impact assessment tool as well from the Treasury Board. So the human, in the equation needs to understand what the ML is doing, how it's doing it, and it's the human who should monitor the performance of the ML process throughout the product life cycle. So moving on to something that's really front and center for Statistics Canada is privacy, security, and confidentiality. We have pre-existing directives and policies on these topics, and essentially, we ensure that the folks or ML practitioners that are developing algorithms are aware of and in compliance with these existing directives. So I've mentioned previously, or mentioned a few times, the need for transparency. And transparency, what we mean specifically by that is that ML practitioners should be able to explain why the algorithm and the learning data were appropriate for the question or the problem. And the best way to achieve that is through comprehensive documentation, which explains how the algorithm works, what diagnostics were used. For instance, it discusses and lays out any biases or limitations in the learning data or the method chosen. And hopefully the code should be made available where possible. Another part of that is that all the partners involved, and so, they're subject matter experts and methodologists and data scientists at Statistics Canada, if they're working together, they have a common understanding of what the algorithm does. And that's including sort of a high level non-technical understanding. Another part is, important thing is reproducibility, not just of the results of the algorithm, but of the entire process. the pipeline, in fact. And so, you know, we advise our practitioners to use a corporately supported version control system such as GitLab or GitLab Hub, and also to version documentation, version the packages they use, etc., and have that recorded so the results and process can be reproduced. So in the sound methods part of our guidelines, we provide some sort of, you know, that's the densest part of the guideline. And we give a lot of practical advice to practitioners. And I think that's, you know, really, really great. So one of the main things about, you know, doing these models is knowing the data, the quality of the data. Do you have sufficient labeled data for your algorithm? If you're using that kind of data, how is the quality assessed? Is it changing over time? So I think one of the things we really want to encourage our ML practitioners to do is know their data. As well, you know, to ensure that our model makes valid inferences, we need to choose the appropriate algorithm and method for validation for that particular application. The same can be said of rigorous modeling. Explainability is a term often used and you know, appears very much in the AI literature. And, you know, essentially the bottom line is we don't want our ML algorithms to be black boxes. That's often an argument leveled against these types of models that kind of degrades trust in them. So we need our practitioners to be able to explain and break down what the ML algorithm does. And so we suggest some kind of practical ways that can do that through text explanations, visualizations, or specific examples. So now I'm going to stop sharing and pass it on to Mohammed.
Thank you, Desiree, and good afternoon, everyone. Just let me share my screen here. Sorry, full screen. Where's mine? Do you see my slides?
Yeah, we see them.
Okay, thank you very much, and good afternoon, everyone.
Oh, Mohammed, they're not in full screen mode.
I'm not in full screen mode. Okay.
Click the view slideshow.
Yeah, sorry. Looking for. And now?
Yep, that's good.
Looks great.
Thank you very much. So good afternoon, everyone. So in terms of implementation of the framework, our framework is enforced through an independent review process of projects, internal and external. External projects, we reviewed some projects of other federal departments. The review is independent because the reviewers are independent of the development of the process, and we're not involved usually in any consultation during the development of the projects. We review what we call proof of concept machine learning projects before the transition to production. What we call production, because before they are adopted and incorporated in a production environment, or if you want, when you develop a machine learning model before deploying the model. So we have reviewed the process is young, and the guidelines were approved in July 2020. So in the last year, we have reviewed over 10 projects, and these projects usually we deal with the image data, text data, and tabular data. Most of the projects we reviewed are NLP based, NLP for natural language processing. So they deal with text data. Here are some examples. Crop yield prediction using satellite data. We had a building type classification from street view imagery, census comments, and for census comments, at the end of a questionnaire, you have a text box where responders are asked to provide comments and concerns, maybe mention the burden, the structure of the questionnaire. So this is text-based. Receipts, auto capture. This is about information extraction and OCR. So this is a survey where consumers would take when they do their groceries, would take a picture of their receipts or scan their receipts and send them back. So this is about extracting some key variables in those receipts. A similar project was about PDF information extraction. Some of these PDFs were scanned. This project was about financial statements. So companies or bodies like Air Canada or the city of Ottawa would for example, would share their annual financial statements, and these are documents could be of tens of pages. And the idea is to detect a page and then extract either a table or a key variable within that page, like total income, total assets, etc. Another project, the client inquiry text classification project. This is about rerouting requests or emails. And these projects, we run these projects for an external federal department. And it consisted in when you receive emails, then you will reroute these emails to the right department. So for example, to HR, to pay, to security. So this is a multi-class, multi-label classification problem. So one email could be rerouted or sent to more than one department. So it's all about gaining efficiencies here and automation. Now let me switch to, this is a very high level depiction of the steps from inception to production of a typical proof of concept machine learning project. So we have projects that we run at the data science division and within StatCan, and we have projects also we review of external clients. So usually we start with a proof of concept, with an idea, we formulate the idea, we develop a proof of concept model. And then if the client is happy and want to adopt the solution and maybe incorporate the solution in their production environment, then at the transition to production, we talked about scaling up the model and integrating the model or the AI product to the production. And before the transition, at this stage here, it's here where we review the projects before they go to production or deployment. Say you develop a machine learning model and then you deploy it, or chatbot, for example, and etc. So and the review here will consist on a self-assessment checklist that we share with the project team. They have to fill up and send it back. We do a technical peer review, a technical and ethical peer review. In fact, given the documentation they provide, usually when we have control, they provide also data and code. We also do code review, another section. And it happens also that if for certain projects, that the projects has to be presented to a scientific, I skipped here, a scientific review committee. This is a committee comprised of managers, chiefs, and above, and technical people who will review also the projects. So our intervention is before the transition to production. Ideally, in fact, we would love to, when we have control, to start our intervention in this whole quality assurance process at the start of a project, of course. For our projects, we do that. So there is an ethical review. Our data scientists have the self-assessment checklist. We do an internal light review. This project might go before the internal or external data ethics committee. And after that, if client is happy with the solution, and we are talking transition to production, then we do a formal review. I will go into more details in a few slides. Okay, so in summary, we develop a model, and then we decide that we go to production, and our intervention is here at the transition to production phase. At this phase, where we use the responsible machine learning checklist, which is a questionnaire. I will describe it in a few slides. And we do also a technical methodological review. The methodological review will cover team's sound application and sound method, whereas the checklist will cover the four teams. So what is this checklist? So the checklist is just a questionnaire. It's a set of questions, around 40 questions. Some of them go to a certain detail, but most of them are high level type of questions you ask at every stage of your development, pre-design, design, and deployment. So the checklist consists of a list of questions whose honest answers will indicate whether or to what extent the guidelines have been followed. So each framework guideline is translated into specific questions. I will give an example or two later. And this checklist is to be completed by the project team. So we provide the checklist to the project team, they fill up the checklist, and then they send it back. And to this checklist, together with their report, sometimes they have a report, a technical report, methodology report. In some cases, we have access to data and code. In some cases, not for external clients, and because of confidentiality also. So we don't have access. So here is an excerpt of the checklist. So this is we have two formats. This is a fileable PDF, and you see under team sound applications and their guideline and their attribute reproducibility of process and the results. So I'm sharing here just a few questions. So question 18, is the code version controlled with a corporately supported system? Did you use GitLab? Did you use GitHub? Can you share the link? So the project team might answer yes or no, have a comment here. So who filled up the self-assessment? Who was the peer reviewer? Sorry. And of course, this form is in both French and English. So we have it in fileable PDF and also in Excel. With external clients, they have like a button in the fileable PDF. Once it's completed, we click the button, we receive an email into, we have a functional mailbox where we receive these, and then we save them into a database. Okay, so this is maybe in terms of review, the most important slide here. And it really details what the review process is about. So the peer review, technical and ethical review consists in, so designated interviewers will review the completed checklist and the relevant documentation provided by the project team. So the project team may provide a methodological report, may give us access to data and code, plus the checklist. So the data science division, which is us, these are experts in statistics and data science. We review sound application and sound methods. And our colleagues in the data ethics secretariat, who are experts in data ethics, we review respects for people and the respects for data. Of course, there are things that overlap, like bias. We all look at bias, but from different angles. And depending on the sensitivity of the project here, the internal or external data ethics committee may be called to review the project. Now the appointed reviewers, usually we appoint reviewers from the data science division and the data ethics. They both will produce a report. That report, we compile everything in one report. And then in that report, usually we have a section where we acknowledge best practices in that project. We provide major and minor recommendations. And then there is a back and forth with the project team. And if we have questions for them, especially if we have major recommendations, then they have to answer those. And after that, possibly this project, depending on the project, if it is high profile project or sensitive projects, it usually goes, they have to present before the methodology scientific review committee. So, and these are technical people who are going to review also together with the client division as sound application and sound methods, and provide recommendation and guideline and approve or not the project. So far, the projects that went before this committee were approved. Now, briefly, I will go through this at the next. For the sake of time, for these next slides. So in terms of recent and forward-looking initiatives and raising awareness, we have presented this framework to external and internal audiences. For example, we presented to the Advisory Council on Ethics and Modernization of Microdata Access. We are developing a course or workshop, three courses to promote responsible AI. So a responsible and ethical use of AI and the StatCan experience, a course on bias in data and in the AI process, and another one more technical about explainability and interpretability of machine learning models. We also conduct research under the umbrella of responsible AI, and the findings of the research will help improve the checklist and the guidelines. So this is what we're doing. We adopt an evergreen approach to the framework. So our next steps is to publish the checklist. The guidelines are already published and online. We review the framework on a yearly basis, and we continue also to provide tools and support. In terms of collaboration, we are in contact and collaborating, for example, with Microsoft, especially Microsoft AI. We are reviewing some of their tooling, like the Microsoft Responsible AI dashboard and other tools, and we are open to collaborations. We do research. These are just a few examples of what we do. For example, we did research on explainable and interpretable AI. We reviewed, among others, Professor Cynthia Rudin's work on interpretability. We have also on phase 2, another project on automated machine learning, AutoML. You have to understand that in government, we at StatCan and elsewhere, we have access to the cloud, and we have access to certain tools like Azure AutoML. So people use that. And we have some upcoming also projects on fair ML and Versailles scenarios, etc. And these are all under the umbrella of responsible AI. In conclusion, I would say that there was a requirement, there were needs, the use of AI and machine learning methods responsibly, maintaining the trust of Canadians, and produce, of course, in StatCan, good quality statistics. And StatCan experience has been the creation of the framework and the review process. So that's all from me. So I thank you. And if you have questions for Deirdre or myself, please do. Thank you.
Thank you so much, Deirdre, Mohammed. I'll just ask you to stop sharing and ask our panelists to come up. And it was great to share that. I think a lot of people didn't know about the framework, so great to learn more about it and speak about it. So if you could just stop sharing.
Sorry.
No problem. And while we're doing that, I'm going to quickly introduce our panelists. Again, if you have questions, please use the Q&A function as I'm introducing. and we'll get some reaction and discussion going. So I'd first like to introduce Nancy Andrusek, who's the Director of Research and Ethics Services at Public Health Ontario. And she leads the development and implementation and evaluation and management of research and ethics policies, practice, products, and services. She's an adjunct lecturer in the Dalla School of Public Health and a member of the Joint Centre for Bioethics at University of Toronto. Next, we have Shayan Guha, who's an assistant professor in the Faculty of Information at the University of Toronto. And he's helped develop undergraduate and graduate data science programs, including the Faculty of Information's Human-Centered Data Science program. His research focuses on algorithmic bias and decision-making in public services, including healthcare. And he's the co-author of Human-Centered Data Science and Introduction. So really looking forward to hearing those perspectives. Also, last but not least, Leif Pagalan, who's a PhD candidate at the Dalla School of Public Health, University of Toronto, and also a graduate fellow at the Schwartz-Reisman Institute for Technology and Society. Their research focuses on socially equitable and algorithmically fair machine learning applications applied to population health. And they were also instrumental in organizing today's event. So thank you, Leif. So without further ado, let's jump in. We also have our Stats Canada colleagues who presented on the panel with us. So again, please feel free to enter your Q&A in the chat. But I'm going to start off going to you, Nancy, for your reactions and reflections. How might you see this framework be used in an applied public health setting?
Thank you, Laura, for the invitation to join this session, and thanks to the folks at StatsCan for your presentation and for your investment in developing this framework. I think it'll be very useful because you've translated some very high-level concepts that we often see in a lot of the responsible AI frameworks and brought it to a level where it can actually be applied, including thinking about some of that implementation. So that's a real move forward, and I think it's very applicable to applied public health. With applied public health, the objective is to inform action, such as policies and programs, to improve health and health equity. And so for me, although all of the parts are definitely applicable, for me, what stands out are the themes of respect for people and privacy in terms of where the applied public health lens might be, modify that or bring some additional considerations. So that's what I'm going to focus on, and I should acknowledge that this is also the areas that I dwell in, and there might be folks with the data science perspective who will say no, there are other special considerations as well. So I'm bringing you my perspective there. So the first thing I would focus on is value, because I think that's hugely important. And again, because applied public health, the a point is to inform action. I think it will be important to articulate projects, the specific problem that a machine learning activity is seeking to address, and to clearly define what the link is between the project and the activity and the solution. A challenge, however, though, with value, with trying to think about value, is that it is a subjective concept. Is it important to? Is it better to improve health, or a modest improvement in a large number of people, or a major improvement in a small number of people? These aren't questions that are have easy answers. One thing that could inform that question, however, is to clearly articulate the intended beneficiaries of a particular project, and to clearly map those out. And in some cases, it might be very important to bring in communities who are the intended beneficiaries to help identify that we're aiming for the right values, and to also help ensure that the project is designed to achieve those objectives. Another area, prevention of harm, that's in the framework. With public health projects, harms can be informational, such as creating stigma or privacy breaches. But again, because of this applied, bringing this machine learning algorithms or models into actual action, models that are biased or of poor quality may lead to policies or programs that bring harm to health or worsen inequities as well. So again, meaningful dialogue with stakeholders throughout the project lifecycle might be useful to help identify potential harms, or to identify ways to mitigate harms if they're unavoidable. Another topic that's mentioned in the framework is fairness, and the items that were included in the framework, I think, are again all applicable to public health. One thing that we might consider as an additional element, and this one might be a little more controversial, but in public health, the foundational goal is reduction of health inequity. So for the public health context, it may be that at least in some projects, there might be a requirement to explicitly consider how the project is addressing health inequity. Regarding accountability, there's note about who is accountable. And I think that's a question that's equally applicable in public health and will need to be addressed. I think, we can have some thoughts about who that might apply to. It's probably going to be not just one individual or one group, but probably layers of accountability. I also agree it's important to include a plan to monitor for performance and to look at unanticipated, unintended consequences after implementation. I think that'll be really important. We speculate and try to anticipate risks. There's lots of talk about potential risks, but often find out we're surprised when a project is implemented for things that we hadn't even thought might happen. And on the other hand, we also, I think, spend a lot of time worrying about the unknowns that maybe are not going to be an issue. So I think it'll be important to collect data about performance to not only to know about a particular model or algorithm, but also just to inform the area the field more broadly. And the last category I'll comment on is privacy. Public health uses data from a wide variety of sources. So processes for data access and use may end up being quite variable. In legislation, privacy typically focuses on individuals, but in some instances, the communities that are the focus of the applied public health may also have a say about access and use of their data. For example, with Indigenous data, there are various governance protocols that have to be adhered to. So these varying requirements will have to be taken into account if we applied the framework. So I've focused on specific elements of the framework. Applying the framework itself may bring new oversight to projects that previously weren't involved in any particular scrutiny. And so that is another thing to think about. I won't get into, but just how would we actually implement this framework? And I'll stop there.
Great, thank you, Nancy. Thanks for giving us the perspective on how we would actually operationalize this in public health. Lots to talk about. I do want to follow up on accountability and how we might think about that with Deirdre Mohammed. But before I do that, I'm going to shift gears and go to Shayan for a moment to talk to us about the challenges and opportunities of working across disciplines. So one of the great things about this type of work is that it does involve computer science, engineering, health disciplines, maybe coming together. And I wonder, based on your experience having done this, can a framework like this help us better interface across disciplines? What do we actually need to do to be able to work across disciplines like this?
Yeah, absolutely. I think there's a couple of things to think about, discuss, or consider when we think about, okay, if such a framework exists, then how can this framework be applied or generalized or extended when you're working with someone, when you're working across a variety of different kinds of teams or organizations with different value systems. And I think the key is right there, that different kinds of organizations and teams have different value systems. And oftentimes, a lot of the friction that happens in terms of developing AI machine learning models that turn up not to be very good is because there was very little engagement across these competing, often conflicting value systems that do exist. So for instance, in some of the work that I've done pretty recently, where I've worked with child welfare systems in the United States, there are different value systems within child welfare systems that you need to really think about, even if you were to collaborate with them to help them make better data-driven decisions. For instance, the legal side of child welfare systems has a particular value system. The caseworkers on the ground have a particular value system. The foster system itself, along with the foster parents, is an important stakeholder. And of course, the people who make the regulatory decisions, the supervisors, administrators, powers that be, they have different value systems. So on one hand, what happens is, let's say that there comes a top-down diktat from the state government that we need to reduce costs in child welfare. And then that kind of gets percolated down. And the idea is, okay, let's build a predictive model that can, a certain risk to a child. Except that's not really what the caseworkers care about. They're not really that concerned with risk to a child. They're more concerned about positive outcomes for a child. And these are two different values that often kind of conflict and negotiate, and it needs negotiation. So I think that is key. And this, of course, is a broad relationship with existing structural powers, especially within government agencies, within the government system. There are hierarchies and networks of power that determine to a large extent how decisions are made. But I think that, there's a lot of kind of human discretionary work that we need to think about when developing these kind of systems. One of the things that I would like to point out that I possibly did not hear in the conversation, so I just wanted to kind of, ask the speakers, is, a lot of the times the issue is not in actually developing a model. Smart people generally come up with good models, but it's really the act of making decisions from an algorithm, especially within a public agency, within public services, that is key. And that largely has, I don't know, like maybe 3 dimensions to it, right? I mean, there's the dimension of human discretion that I was talking about. There's the dimension of existing laws and regulations that I think was alluded to just a little while earlier. And then I think finally, there's also the case of algorithmic literacy, because, if you develop the model and send it to an agency, you're not going to be sitting there making the translatory work. So, I feel like that is very important, because that's where the high stakes decisions are being made. And I think a framework needs to encapsulate the decision-making process very, very carefully. So, I mean, I'll stop there, but that's, what I have to say.
Yeah, great, fantastic point. So just on your first piece, first recognizing that these different values exist. I think often it's sort of looked over. Now, how we work through our value disagreements, I mean, that's a whole other challenge for sure. But first step, recognizing, I think, is a really critical point. Maybe I'll go to Deirdre or Mohammed just to comment on that decision-making piece. So the algorithm has gone through all the other aspects, which we know, sound, methodological, transparency, et cetera. But someone's going to do something, make a decision based on that. Was that considered in your deliberations as out of scope, or is there future work to come on this?
I can jump in here, Mohammed. So I think you can, just a little bit of an answer to the first one. You can see that we declare our values for quality statistics very, very happily, and we wave our flag. But it's kind of related. It's related to that. So, I think the Treasury Board Secretariat, with their algorithmic impact assessment, really deal with algorithms that make decisions about people, administrative decisions. And so at StatCan, ours was a little bit different. Our framework was a little bit different, because we're not necessarily making those decisions. But you're absolutely right. That's something very important. And so I think that the Government of Canada is definitely thinking about those things, and developing and evolving the directive on automated decisions to kind of think about those issues, because whether it's a diagnosis or a visa, for instance. For a diagnosis, the new method of diagnosing the algorithm needs to perform at least as well as the old method, you know, and so there are different ways to evaluate and benchmark the algorithms and how they impact people. And so I think we are, you know, our value is quality and producing quality results, and we're building our framework to do that. We are not necessarily thinking about the impact on folks because we are not, you know, working so much in that area yet, but we could be. And so I think, you know, keeping up with the Treasury Board and keeping in line and including that algorithmic impact assessment in our guidelines is a really good way to keep abreast of that. Mohammed, would you agree?
Oh, that's a great question. A great answer. So sometimes you see we review models. So we review machine learning projects and models. And then the clients will take these models and make decisions, you know, and so we don't have that control. But one aspect of your question is we make sure that we touch upon the explainability and interpretability of models, that you are able to explain and interpret the outcome of a model to a user. So that aspect we touch, for example, but in terms of having control on what the client is going to do or with the model in terms of decisions, maybe not. But interpretability, explainability is part of the framework.
Great, thank you so much. Sounds like that's a very important next step, and an important next step that probably needs to be done in the context of where it's being applied. So public health being different than healthcare and other sectors, as you brought up. Okay,
and Laura, I would also like to add, I think Jan makes a very good point that we have to consider the decision making at the end of closer to implementation, but we also have to be very critical about decision making before it even happens, before the technical pieces start rolling out. Like, we need to start thinking about data and technology, and you need the experts, like the people working in health, the social sciences, and the ethicists to develop really the problem definition, because fundamentally this is what is guiding model development. So you need to ask those critical questions of like, what are we tackling? Why is it worthwhile? Who is benefiting? And like, what is the end goal or the potentially negative consequences of a proposed technological solution before we even start thinking about the technical pieces of algorithm development? And these conversations about value alignment need to be very explicit before we even get started. And methodologists should also be part of that conversation because they're guiding the development of that technology. And those values should be embedded when they develop those technologies.
For sure. Very well said, Leif. I'm going to go to the chat. There's a couple questions. So the first one is from Andrew Pinto. And the question, I guess, is for Deirdre Mohammed. Can you describe a little bit around some of the methods that were used to inform this framework? I know there wasn't much time to go into it. For example, was it literature review, discussions, or other formal consultation processes?
Yeah, so I can describe that since I was around at that time. Essentially, we came together across the agency. So we divide ourselves into a few different silos: methodologists and analysts and computer science type of individuals, and we came together across the agency under the umbrella of the quality assurance team. Laurie Reedman was the leader. So Mohammed and I are just two people among a large group of people that were involved in developing the framework. And so we were working with the quality assurance framework folks and using some of their methodology, which included literature review. It wasn't a formal methodology. It was informed by discussions, by some key documents among discussions among practitioners in particular. And that's why it took a very practical bent, I think. And also among managers. So because, managers need to know what their staff are doing or have tools to help kind of translate what their staff are doing into the work. So that's kind of how it came about. We relied very heavily on 3 documents that I talked about: the tripod statement, the decision analytic best practice for decision analytics and health economics, and the algorithmic impact assessment from the Treasury Board. And then there were various other documents. So those are the 3 that I can remember in particular. And so we used the same sort of quality assurance framework development as the quality assurance team did, and created some sort of questions and answers in the checklist. Yep.
Oh, thank you. Very helpful. There's another question from the audience. I'm just going to read it out, and this is for anyone who wants to take a first crack at this. In healthcare, individuals may have factors that affect their health that are not captured by the data used for prediction because the data don't reflect dominant culture and other things. How can we address the possible biases that result? Often we will not know the outcomes unless they are severe, and this includes good outcomes. So any thoughts, and again, from our, maybe I'll go to our panelists, you know, how do we know those biases exist? It's been mentioned today a couple of times. How can we start thinking about how we should address these biases?
I might maybe share an element or two. I think when you start working on statistical projects, data science projects, it is very important that part of business understanding and data understanding. I think making sure that you have a diverse team, you know, when you talk involving, for example, if we are talking about disabilities or minorities, for example, involving those people, and subject matter experts are very important, you know, to feed. It's not just about technique, it's about to make sure, because sometimes, you know, there is a bad bias and there is good bias, but there is unconscious, unintentional bias that, you know, bias that enter the stages, pre-design, design, and post-design. There is sometimes intentional and unintentional bias. So we need to make sure to involve subject matter experts, and sometimes even at the modeling stage, sometimes we bias by restricting our model to certain space of parameters because we don't want that model to discriminate. You know, we don't want equality. We want justice. So you don't want that model to harm, for example, or your self-driving car to do something. So sometimes we introduce like positive bias, but it's very difficult because most of the time we don't know that there is bias, and most of the time these are very they're minorities or they are not well represented in the data. So making sure in terms to involve subject matter experts, to have diverse team, to do your due diligence by having a survey, you know, to discuss with these minorities before talking. Technique is the weakest part here. Yeah.
For sure, and I think it needs to be formal part of the assessment, right? Yeah. Assessments of bias needs to be part of the performance as well as the monitoring after, for sure. Okay, I'm just going to, we're going towards the end. Leaf, I want to go to you to talk about how trainees actually train themselves in this field, how to apply these and think through these frameworks and the elements of the frameworks, maybe not this framework in particular, but what do we need to actually start thinking about these things, as you mentioned before, right at the start, because typically a trainee working in AI learns about coding and technical pieces first, not these pieces. So what are your thoughts on this?
Yeah, so I think the data science pipeline can be quite long, you know, beginning with like design and development, going all the way to deployment and production, as Mohammed described earlier. And as trainees, we focus on developing expertise like on a very small portion of this huge technological life cycle. And if we don't have appreciation for the entire pipeline and how things come together, it's quite easy to forget components of a responsible framework, and then negative baggage simply like propagates and accumulates. And I think this presents like a trade-off between breadth and depth of expertise. So I think we need more interdisciplinary collaboration. And And we need to learn from the strengths of other disciplines, and we need more exposure to different stages of that data science pipeline. I think it's important also to emphasize that data science shouldn't be just thought of as just like data, methods, and technology, or else we'll get trapped in a very narrow positivist mindset. And like, to be a good collaborator, we need to understand how experts in other fields are thinking about people, data, methods, and applications, because these different disciplines have their own focus, they have their own paradigms, and also values. And we need to be bridging those silos and having exposure of interdisciplinary experiences and really a high level of perspectives helps trainees understand how the different components are actually deeply interconnected, which is easy to forget when your training is hyper-focused by design.
Absolutely, great point. So maybe I'll just go to you for last comment on this, Cheyenne, because you are developing a new training program in human-centered data science. Is there something that you've learned through that process that you think will help to speak to some of the things Leif brought up?
Well, a little facetiously, I could certainly say that I have a couple of StatScan folks who are currently enrolled in the program right now. So yeah, hopefully we'll be indoctrinating them with this. But yeah, so our human-centered data science program tries to center positive outcomes for people first, as opposed to a lot of data science programs are very model-centric, where they teach you things about the model, and they teach you how to center the model and how to build the best model under the circumstances. And we kind of, we still teach them all of the rigorous machine learning and statistics that you need, but we shift the lens, and we really try to focus on the people whose data are being analyzed in a variety of ways. And I think that what we try to do is, in a very model-centered world, what you would do is you'd start with here's the problem formulation and how we set up the model and how we do the model and how we, here are the model outcomes, etc. And we kind of flip that on its head. And we do start with, as Leif pointed out, a very rigorous exposition of, well, what is the problem of interest? And does it need a technical solution at all? And a lot of the time, the answer is no, there's no technical solution. And I think that data scientists need to have that training in order to understand where technological interventions may or may not be used. Just because there's an opportunity doesn't mean that we should be developing models willy-nilly. I don't believe in that word. And then I think that, we kind of lead students through a variety of human-centered design practices in order to kind of shift their lens of inquiry. So for instance, we focus on things like theoretical design, participatory design, speculative design, while building their models. And finally, we also kind of really talk about outcomes, decision-making, longitudinal, long-term field evaluations in order to test the efficacy of models, feedback mechanisms, human in the loop, all kinds of things. And so I think that that's really where the conversation around data science is moving. I think we at U of T, we're the first to kind of bring in this appreciation in Canada, but this is certainly something that we've started seeing kind of being percolated up from other similar programs in the US and in the UK. And I think that this is where practical data science education and training is kind of headed towards. And we should certainly be incentivizing that.
Totally agree. I think that's a great way to end off to help us kind of round out. We covered a lot of ground today, and I first want to start off by thanking Mohammed and Deirdre from Stats Canada. I really applaud you for taking on this work. It is not easy. And I know that there's many more iterations to come and a lot of work to come, but taking on this work and presenting it and sharing in its early stages really means a lot. And thank you to our amazing panelists, Nancy, Leif, and Cheyenne, for really giving us a lot to think about, how we would apply this, in what way, and actually maybe thinking about the future of how we train and work together in this space. So I know we covered a lot and it was quick and we have a lot of questions. I hope we'll have many more. Hopefully we'll be back for different versions, different iterations. And I thank all the attendees for spending time with us today. Thanks again, all. Have a great day.
Thank you for your perspectives. Take care.
Thank you. Bye-bye.
Bye.
Bye.